But TA process adjustment, we're always looking to improve process, but I think we're at a need, not a want time right now. And we've been forced to make changes to process adjustment, stay in place orders and social distancing. How are these affecting your talent acquisition process?
Yeah, I'll share. So, at Cigna, truthfully, just about 100% of our in-person interviews have now all gone to virtual. Because really our priority is to keep our people safe, our employees, our candidates, and their families and the public safe. That's a big part. I will say too, because I'm sure I did see a question about this, we don't have a specific tool that we're using currently for interviewing, but typically it's phone, or we also have WebEx too. We have company-wide a WebEx account for everyone.
This is Greg. I would echo that in the physician space, where I had some clients who, in the beginning of March when this was coming out, said, I would never hire a physician without doing an in-person interview. And their tune has completely changed by today. And at first it was, well, I'll do it for my most critical needs, critical care positions. And now it's just opened up. So it makes me wonder about how this will transform talent acquisition and onboarding as a whole in the long term. And we've also seen at Healthy Careers, because we partner with medical societies to help them run recruitment events, we've seen all of those events canceled, and I've never seen societies move so fast. We're now going to be launching virtual career fairs with them. And because more and more providers are going to telehealth, more people are doing shelter at home, we really expect a high level of engagement. And it makes you wonder if this is not only a crisis, but an opportunity to digitize the whole acquisition process.
Yeah, I love that, right? Innovation is born out of need. And although the ability to do virtual interviews and virtual events has existed for some time now, adoption hasn't been very rapid. But yes, I love that you make that note, Greg. Like, very quickly, people were forced to make these changes. There was no other way. Mm-hmm. What other changes have you had to make to process during this pandemic?
This is Claudia. We've had to look at our onboarding specifically in a very, very different way, making sure that, of course, we stay that compliance is at the front. Obviously, as far as licenses, and although that has changed now, but certification, making sure that they go through the occupational medicine process, which is our employee health, if you will. But it is, like Greg mentioned, we are looking, it's making us look at the process totally different. And we are finding creative ways on how we can onboard a nurse, onboard a food service worker. I hired 2 nurses for ICU on Monday, and they're starting tomorrow. That's not in our world in healthcare. It's usually a 2-week turnaround. And if we can do it this week, we are moving forward and doing it all the time. We're doing on-demand clinical orientation, on-demand Epic, or our HR orientation is now all virtual. It's a link. So it's great that we can get 18 people are starting tomorrow versus wait until Monday for them to attend an orientation. So that has been a huge shift for us, not just a shift, but a huge learning experience that we need to take the time to look at how we do things and why we do them the way that we do.
I'll share an example on our side. So proactively, we wanted to empower folks who have received an offer and kind of ease any anxiety they had around the drug testing process, because naturally you have to go to a testing facility. well, what if they are testing for the virus there? So that was a big concern. So proactively, we actually removed all of the listings that are in our network for the testing facilities. And at the same time, we also still encourage the candidates to place a call to the facility the day of that they're going, because potentially that facility could close, and even ask them about their cleanliness practices too. So that's another key part of how we've kind of tried to sympathize and empathize with the people who are actually coming to work for us.
Oh, that's great. Yeah, I mean, that's the candidate experience has changed, as you're noting, Ashley, to their concerns through their own process of going through the onboarding process and being qualified. And the acceleration, Claudia, I love what you shared there. The acceleration of the process, like, yes, we need to move fast and we have to do more, and perhaps with less, and adapting to new technologies and all these things at the same time. Yeah, definitely feeling the need.
But believe me, it was blood, sweat, and tears. It wasn't easy. It was long days, and it was coming together as a group, and all the stakeholders getting on the phone and speaking for half an hour, 40 minutes. Let's bang this out, if you will, and let's get creative here, because we need to get creative, and we did. So we're now looking at a list for Monday. We have 30 some people in the pipeline, so we're looking to start them Monday and Tuesday. It's a necessity, and that's what we have to do. We have to deliver. So that's what we're working on.
Fantastic. Yeah, there's a lot of interest around virtual interviews because people have had to adapt, digital transformation in a virtual world. Our surveys were showing that 79% are doing virtual interviews. As Ashley pointed out, we're almost 100%. So I expect that this will continue. And I love what Greg was saying before, because will it maintain? Is this temporary? I don't think so. I think that this is going to force a digital transformation to make a norm in the industry, personally.
Yes, CVS was doing this even before being forced to change. We had already been using virtual interviews, virtual events, chat events. We have AI. So we had been investing in deploying those sort of technologies early on. And then when CVS fairly early on in all of this went to a virtual setup. So for our colleagues, for everyone who works for CVS, they transitioned anyone and everyone that they could out of physical locations, and then shut that down to not allow anyone outside in. So very rapidly, we had to have nearly 100% uptake from everyone in our TA organization to start using those tools. So for us, to your point, it's not going to go away. We were doing it before, and now that the entire TA organization is becoming more comfortable with it and our candidates are embracing it, we're definitely going to keep it. It's going to be sticking around for us for the long term.